Hello, everybody. On behalf of Jagran New Media, I welcome you all to this interactive session brought to you through the efforts of United Nations Office on Drugs and Crimes, that's UNODC, and onlymyhealth.com, a leading bilingual health portal under the Jagran New Media umbrella. My name is Megha Mamgen, and I head the health and lifestyle verticals at Jagran New Media. Now, 26th of June is observed as the International Day Against Drug Abuse and Illicit Trafficking. The idea to earmark a day like this is to strengthen the action and cooperation to achieve the ultimate goal of a society that's free of drug abuse. Now, today we attempt to spark a dialogue around a subject that needs attention, since we all know that there is a rising death toll due to drug abuse, and there are increasing cases of addiction that are impacting men, women, minors, families as a whole. So let us look at the drug problem in India while we're also dealing with a global pandemic and an increasing concern for mental health as well. And we have an eminent panel joining me today. Let me go across to all of them and introduce them to you. First up, Mr. Sergey Kapinos. He is the regional representative for South Asia, UNODC. Thank you so much for joining in. Dr. Bilali Kamara, country director for India, UNAIDS. Ms. Radhika Chakravarti, she's the joint director, Ministry of Social Justice and Empowerment, the Government of India. Mr. Rajesh Nandan Srivastav, he's the Deputy Director General of the Narcotics Control Bureau with the Government of India. Dr. Atul Ambekar, he's a professor with the National Drug Dependence Treatment Center at AIIMS. Mr. Moses Pachwao, he's the president at the Indian Drug Users Forum. Thank you so much. Appreciate your presence here, gentlemen and lady. It is an honor for me to host this power panel, and my attempt will be to keep this interactive and fluid as much as possible, but I do request my guests to keep their answers brief, just with the time in mind, and because we do want to hear pertinent points raised by everybody in the panel. So let me jump straight across with my first question, and I am putting this across to Mr. Kapanos, you, and I would love to hear Ms. Radhika Chakravarti's response as well. But first up, Mr. Sergey, on World Drugs Day today, how do you see the drug problem in India? Are you seeing any trends, any patterns, especially with a global pandemic, COVID-19, at play as well?
Thank you, Megha, very much. I'm delighted to be here with such an august panel of experts. Will you allow me to dwell a little bit on the World Drug Day? Well, we observe it today, and the focus is on better knowledge for better care.
Sure. And
the world free of drug abuse requires global, coordinated, evidence-based and multi-stakeholder action. And UNODC is at the forefront for combating trafficking in drugs and drug abuse. So I invite our viewers to join UNODC's efforts by sharing facts for solidarity today. And I'd like to refer to the recently launched World Drug Report 2020. And actually, if we are talking about India, India in a big way reflects the outlined trends in drug trafficking and use. Some figures. As per the report, approximately 35.6 million people suffer from drug use disorders globally. And more than 260 million. So these are gigantic figures. So some features of the report, which are relevant to India as well. Adolescents and young adults account for the largest share of those using drugs, while young people are also the most vulnerable to the effects of drugs because they use the most and their brains are still developing. With regard to specifically India, the country's geographical location is very special. It is sandwiched between the Golden Triangle and the Golden Crescent. And in this sense, well, it is the doom for some, I would say, very proactive trafficking in drugs through its blue and green borders. And the latest trend is the increase in the use and trafficking, of course, of synthetic drugs. So as we are talking about India as the biggest country in South Asia, we can talk more in a more broad, I would say, geographic parameters. And in this sense, I'd like to emphasize the increasing importance of maritime routes, and this is a growing concern as regards law enforcement activities. I have to compliment law enforcement agencies in India for outstanding performance of late and outstanding narcotic seizures, including maritime. But still, the situation, overall situation, is very grave, and well, a lot of efforts are needed to be taken forward. And successes can be reached only if we follow a systematic approach, means keeping at par both demand and supply sides and promoting human rights-based, gender-responsive and health-centered approach.
Sure.
And I believe that my colleagues from the panel can provide some figures which are reflected in the survey conducted by the Ministry of Social Justice and Empowerment, which was published in 2019.
Yeah, let's go across to Ms. Radhika Chakravarti. Sergey is really pointing out to how grave the situation actually is, despite all the work that is going on. And he's also indicating to the importance of a combined and synergized effort. I would also like to hear your point of view in the drug situation as it is evolving with, India battling a global pandemic. Are you seeing any change with the current situation?
Yes, Megha. So basically, when we are looking at, Ministry of Social Justice and Empowerment concerned, and we are working in tandem with the Narcotics Control Bureau and with the Health Ministry and AIMS, NDDTC AIMS, for the treatment-related things. So the survey findings, this is the first time we had this comprehensive national survey done in India, which has given very startling findings. The basic thing is the trend and the findings which are documented as that there's a substantial increase in substance use amongst the younger population, and more of this younger population are being initiated into the use. Very alarming. And both the mental and the physical related issues with both and during COVID. And it exists, the substance use exists in all the population groups, but the reporting mostly is done from the men, adult men. And survey also indicates prevalence in, and the usage.
Yeah, sure. And now that kind of takes us to the points that both of you raised, is actually the availability and that supply of drugs. And who better to answer that question than Mr. Srivastav? And I've been saying that you've been in news, Mr. Srivastav, for the right reasons, perhaps for busting drug rackets and nabbing drug lords, as they say. But we'd like to hear what your point of view is on how these drugs are actually reaching the consumers, because they seem to be, drug use seems to be more rampant, and there is recreational use of drugs, and we've heard of rave parties. So what are the kinds of checks that are in place, and what does the law say about sale and use of drugs?
That's a lot of questions for me to ask.
Yes.
The brief time that you will allot me. But first of all, thanks to DC, thanks to the Jagran Group for inviting us over. Compliments also to DC for choosing an excellent theme for this day's International Drug Day, which is better knowledge for better care. I don't think we could have opted for a better theme for all, any agency that we are working for. If we inform our actions with better knowledge, I think the output would be so much better. Now, plunging straight to your questions, how do the drugs reach our people? We have several sources of drugs, and as Sergey alluded to, first of all, we can't choose our neighbors. So India is sandwiched between two major drug-producing countries. And what's happening over there? In the last 2-3 years, we've seen record production. So that record production, let's say in Afghanistan in terms of heroin, manages to reach us in myriad ways. The land route, the air route, the sea route. In fact, you name whatever route that you might think of, it enters into our country through all of these routes. Likewise, we have our eastern borders. There's increasing heroin production in Myanmar also. To top it all, of late, again, as Sergey alluded, we have Afghanistan also producing a great amount of methamphetamine. And we now find in our intelligence, in our seizures, a lot of maritime trafficking for methamphetamine. Now, once it enters this country, there is a whole supply chain, if I were to say so. So there would be a wholesaler, and then there would be a retail chain. And then they would reach out to people who are consumers. And here, very quickly, I'd like to mention the educated urban youth in this country, we find increasingly using the internet, both the surface net as well as the dark net for ordering drugs. So in fact, with the COVID crisis and all that, traditional transports being affected, you just can't, if drugs were dependent solely, let's say, on account of air traffic, that has virtually stopped now. So people are relying more and more on postal shipments, on courier shipments. Those are deliveries that are ordered over the internet, and they're delivered right into the homes of people. Second thing, again, very quickly, that I'd like to mention is a recent, observation that we've had, is that because of COVID, again, because traditional supply is being affected, we find focus on a lot of indigenous drugs. And we have to be conscious of the fact that in India, there are several states that produce illicit cannabis, they produce illicit poppy. Almost every other day, our units of NCB, let's say in Rajasthan, are catching opium that is produced illegally in Jharkhand. Likewise, only yesterday, our team in Lucknow caught, in fact, if you have read the papers, you've read the news, Pune Customs caught so much of ganja which was originated to the Andhra-Orissa border. So this we find, with the international supplies sort of being choked through the air route, people are using more and more of the maritime route, number one, and also relying on domestic sources. I'll stop my answer here.
No, but Mr. Srivastava, you must talk about the repercussions, because you did talk about how easy it is to get access to drugs. But what are the checks and practices that your agency has in place, and what are the sort of repercussions once caught in the act of selling or using narcotics?
Right. First, the repercussions, the drugs, and I'm glad that you raised this issue, because this is reaching out to an audience, hopefully, that will understand what are the grave consequences if one is even consuming drugs. So the narcotics legislation of the country is an extremely strict one. If you're a trafficker and if you're caught with commercial quantity of drugs, the minimum that you get is 10 years imprisonment. 10 to 20 years is the range of punishment. Even if you are a consumer of drugs and you're consuming a small quantity, as of now, you are still liable to be punished for punishment up to 1 year. And of course, if you are a so-called addict, and my apologies to Dr. Ambedkar for use of this term, I know he doesn't like it, but the Act actually uses it. You can volunteer for treatment, and then it gives you immunity from prosecution. So the consequences are very grave from the legal perspective. Of course, the consequences are huge from the health and human and society perspective. Another consequence that I would just like to pinpoint, a drug trafficker is just not dealing with drugs alone. He's dealing with a lot of illicit money that is going to flow in, and he's going to use that money to finance a lot of other crimes. It could be terrorism, it could be arms trafficking, it could be hawala, so on and so forth. It just sets off a chain of other crimes.
A cascade of crimes.
Cascade of crimes. So, any consumer of drugs, hey, look out. If you're using drugs, you're giving a handle for this trafficker, not only to take money out of you, not only to deprive you of your own health and well-being, he's going to cause a huge amount of harm to the society and to this country that we are so proud citizens of.
Absolutely, absolutely. I'd like Mr. Moses to bring in his point of view at this point. And like I mentioned, that there is a sort of, I don't know, a lure towards drugs. And I do want to understand that does media glorification have a role to play? And the lack of, and because again, the emphasis is this time on the knowledge and the awareness aspect. So does the lack of knowledge, media glorification, just the fact that it's so easily accessible, does that contribute to the use of drugs? I'd like you to unmute yourself, Mr. Moses, please.
In a way, yes. Because media glorification and portrayal of drugs in the media has been done since time immemorial. So this has been a cause of doing drugs for some people in now and in the past, and yeah, but this also, the media also provides a plethora of knowledge to help us understand this kind of substances also. So yes, media is both, I would say, a curse and a blessing.
All right then. The other aspect I did want to talk about, and I'd like to pose this question to Dr. Atul Ambekar and Dr. Bilali, is that, health and social factors, how do these play in the use of drugs consumption, and how does that impact, drug consumption or abuse? How does that impact genders differently or demographies differently? And also, I'd just like to add to this that the connection of drug use and abuse with, diseases and viral infections like HIV/AIDS. Dr. Ambekar, if you could take that first, and then I'll take it across to Dr. Bilal.
Yes. Yes. Thank you very much for this opportunity, and a very good afternoon to all my esteemed fellow panelists. A very important aspect which we must remember, and which was highlighted partly in Mr. Srivastava's talk also, that despite all these security efforts, all these law enforcement efforts, drug supply continues, drug supply reaches to people. Why? Simply because there is a demand for drugs, right? Even if there were lots of drugs available and produced, and if there was no demand, then these drugs would not work. So drugs are reached because there is a demand for has always to consume one or the other psychoactive substances to change their mental state. More the frustration, more the vulnerability in the society, including more the biological vulnerability, more is the chances or risk of mental health problems, and which are in quite a few cases are also associated with substance use or drug use problems. So basically, world in society or community, just relying on very tight security apparatus and law enforcement supply control approaches is not going to be enough for us. What we need is the health and welfare services. The International Drug Conventions also, which are the treaties binding all the countries of the world together against drugs, they also have health and welfare of human society as the central pillars on which the entire drug control framework is based upon. So basically what we need to address is the vulnerability of people, of why they go into drugs, and secondly, once they fall victims of drugs, once they suffer from whatever use disorder, then they need to be made available all the health and welfare services. And fortunately, now medical science has made such progress that many people with drug addiction can be provided very good kind of help. And I'll stop right now, and because later perhaps we can elaborate it more.
Sure. Dr. Bilali, would you like to talk about the connection of drug use? Does that make a user, is a user more vulnerable to diseases like, or conditions like HIV/AIDS? What is the connection really?
Thank you very much. And I would like to start by saying three important points which I believe are important. From our perspective, drug issues are really three-dimensional. One is the supply, One is the demand, and one is the mitigation. And I will not talk about the supply and the demand and area, but I believe you could understand that one ministry cannot solve the drug issue. It is home affairs, it is social development, it is education, it is etc., etc. It is really multidimensional, and a multidimensional answer is necessary. For the mitigation component, I would like to insist on two areas which I believe are really very important. One is really the harm reduction. And that is clear because if you look at the disease patterns, you will see that, for example, among people who inject drugs, they have 40 to 60% who have hepatitis C. If you look at the HIV condition, they have they are the highest in terms of HIV prevalence. It is 6.26% in India. It is 30 times the prevalence in the general population, and that is telling you a lot. And what is really important into this is to look at our programs. Yes, we need to act on the supply area. Yes, we have to act to the demand area, educate people, help people not to get themselves into the issue, but also to really look at what are really the best practices in terms of harm reduction. And on this, I will insist on one thing which has been important, and I believe Sergey has touched on it. That is the prison survey, which we have conducted this year with NACO, which has shown that, again, in the prison population, you have 10 times HIV prevalence higher than the general population. And if you look at that prison population, you will see in some settings like where Maurice is in Mizoram, 50% of the prison population are drug users. And our colleague was talking about harsh laws. They exist, but is that the answer? I will say no. Taking somebody who is using drugs, putting him in jail will just make him hardcore. It will make him marginalized. It will make him lost. We don't want that kind of harsh law to really exist. What we want is really laws which can really help us to achieve the harm reduction. You have been using drugs. You have to be rehabilitated. You have to get, if you want your de-addiction therapy, you have to get your medical health, etc., etc. If you want to stay using it, let us help you to use it properly. And I will give you the example in the Netherlands where I'm sitting today. I have seen methadone users who for 30 years are using methadone, and the government is providing methadone to them on a daily basis. And that is the way we believe things can go in a better way. I will give you the example of Washington, D.C. When I came in 2004 to really look at the HIV/AIDS program there with the CDC, we have looked at the drug users component, and they had those harsh measures which were in place. We catch you, we put you in jail. You cannot put drug in jail. It is not the right place. So what we have suggested to them is to look at the Dutch model and see needle exchange is an opportunity, and OST is another opportunity. The oral use is another opportunity, and what we are seeing today in India, because of the COVID, if you want, a pandemic, beyond the maritime control, beyond the air control, etc., the reduction, if you want, into supply. And unfortunately, our colleague said that the internal, supply is increasing. The problem is simply, or the solution is simply that we have really seen that people are moving because of the lockdown. They are moving from injecting drug use to oral use. Which is an advantage because we will really reduce as much as possible. And that's what I've told to NACO. We are giving people home take doses. And they have really to push for that as much as possible. It is the best way to go. You will get your hepatitis down. You will get your HIV down. Yes, people can really be, if you want, mentored, educated, supported as much as possible so that we get good people out of jail. We will get good people out of drug. That
Yeah,
will be the
very,
approach
very,
which I
very
will
quickly.
undertake.
I just like, I want to go across to Sergey, but just very quickly, Mr. Srivastav, I do want to understand that in India, like Dr. Bilali is pointing out, there is an option of rehabilitation or imprisonment, or is it both? What is the situation here when you do nab somebody who is a user? And I hate to use the word nab, but you know, what are the options there?
Yeah, so the options are very clear. There's a particular section in the Act which says that if you are a user, and more than a user, if you are an addict, again, apologies for use of the word, the Act uses it, the addict has an option from getting immunity from prosecution, provided he opts for treatment for de-addiction. That is the sort of provision in the Act which already exists. Having said that, you know, I have statistics. I could, you know, not agree more with Dr. Bilai. We have statistics in the year 2018. Out of the 60-odd thousand cases which were booked for, you know, which were booked for drug matters, about 60 to 65% related to possession on account of personal consumption. And glaringly, out of the 48,000 people that were caught for drug use, 26,000 fell in the age bracket of 18 to 30 years, which points out to a greater use of drugs amongst the youth.
Right.
All of us, Dr. Bilai, I'd like to show you, are looking at our laws once again. He's absolutely right. We need a balanced sort of an approach. This is an age of reforms. I can happily share with you that the government is engaged at the very highest level on the drug matters. And all perspective of the problems are being looked at right now, including legal reforms. Hopefully, we'll have more conducive laws in the near future.
Right. Thank you, Dr. Srivastav. Let me go across to Ms. Radhika Chakravarti, the Joint Secretary for Ministry of Social Justice and Empowerment. And Ms. Chakravarti, my question is that one can imagine that it must be difficult to conclusively say what the numbers are. I mean, what are the number of addicts or users in the country? How does the government go about responding to an issue like this? And would you say we're on the right track, considering, you know, that this is an issue that has various aspects to it?
Yes, Megha. I think the government response as a part of the government, you know, its response and the actions are very focused and impact oriented and very consistent. To begin with, the first step is that we have accurate knowledge now on the extent and the pattern of the substance use in the country. We do not know, we know that, you know, through the survey, we know that what are the national figures and what are the state level estimates of people who are using drugs and who are affected by the drug use disorders, which enable the government to actually review the presence of services and interventions that need to be planned for these individuals and the families, and also to identify the gaps in the service delivery and plan our future course of action. So if you've seen that, you know, this drug abuse normally occurs for two factors, because of two factors. One is availability of the drugs and the social and the psychological conditions which result in the abuse of these drugs. So there is both actually a supply and a demand aspect to the problem. So as far as the demand reduction is concerned, the Ministry of Social Justice and Empowerment we formed a national action plan. It's a long-term action plan for the year 2018 to 2025, which basically focuses on educating people, because awareness is the key, and for providing a whole range of community services, which includes the identification, motivation, counseling, treatment, aftercare, and rehabilitation of not just the affected person, but also of the families. Now, for the year 2020-21, we have a very specific annual action plan, which is intended for the 272 vulnerable districts across the country have been identified. And these districts have been identified based on our survey inputs, as well as the inputs from the Narcotics Control Bureau from the supply side. So we have identified these districts based on these two inputs. And we are now focusing all our interventions in these 272 districts. So each of these districts will have an integrated rehabilitation center where the addicts can go for the counseling and the treatment. And each of these districts are going to have something called a community peer-led intervention programs, where a peer from the community itself, like say a particular slum is there, the person from there would be selected and trained. And this person, a peer educator, would go back into that community and educate and talk to those families there of those vulnerable youth and adolescents there, so that the impact is more. That is one intervention we are doing. And having identified these people who are vulnerable, we are going to bring them back to the integrated rehabilitation center for the counseling and the treatment, and also going to set up these drop-in centers where the day treatment facilities are available. They can take this treatment and go back to their homes. And we are also setting up in the government hospitals in these districts addiction treatment facilities. This will be done through the AIMS. That is also, is happening. And as you all know that, the youth and the children, youth are the focus at the present, according to this annual action plan. And we have roped in the UGC, University Grants Commission, and AICTE, which is the All India Council for Technical Education, to do all the intervention, awareness generation interventions in the higher educational campuses. And we believe that this is going to yield a very good result, because a peer talking to the youth, a same age person talking to the youth, is going to have a lot of impact. And since we have all these organizations on board with us, we expect this annual action plan to be very successful in this coming year.
Yes. Very valid points, Ms. Chakravarti. And I think I owe you an apology. I think I mixed up your correct designation. I would like to clarify to everybody watching that Ms. Radhika Chakravarti is the Joint Secretary with the Ministry of Social Justice and Empowerment, the Government of India. And we're very, very delighted and happy that she's joining us for this conversation. Now, moving on, I would like to talk about, and especially because there is a lot of concern with the lockdown and possible instability in the post-COVID-19 world, mental health has become a buzzword. But I do want to understand this sort of vicious circle that, anxiety, depression, leading to use, and then leading back again to mental health concerns. How does drugs, what's the role of drugs and this whole balance and seesaw of mental health conditions and disorders? Dr. Ambikar, would you like to take that up? And then maybe I can come back to Ms. Chakravarti.
Yeah, sure. So basically what we need to understand is most of these so-called addictive or psychoactive drugs or substances, they have this common property of elevating your mood, of providing you some kind of pleasure or happiness. So hence, people take them to increase their level of happiness, to increase the satisfaction or pleasure which they want to seek in their lives. And hence, naturally, people who are suffering from some mental health gap, some vulnerability, something amiss in their day-to-day lives on account of their mental health, they are more vulnerable to try these substances as a kind of self-medication, as in a way to improve their own sense of well-being. And hence, these substances or drugs, they have a bi-directional relationship with mental health problems. Either because of mental health problems, people can take them, or because of taking them in an excessive amount, in a harmful pattern, there can be more mental health problems, and this vicious cycle can then go on. So we must remember that if in a society we see a lot of drug use taking place, that means there is a vulnerability in that society. It doesn't mean that there are a lot of antisocial people having fun, It simply means that there are a lot of people in that society whose mental health needs are not being met through other means. And that's why possibly they are resorting to it. And hence in post-COVID-19 world, all of us mental health professionals are really concerned. We are going to see a wave of epidemic of all mental health problems, including increasing use of and addiction to psychoactive substances.
Ms. Chakravarti, would you like to add to that?
Yeah, sure, Megha, because this is a very important point. See, lockdown situation, it entailed actually the non-availability of substance, which actually could be a blessing in disguise for the people who want to quit the habit altogether. But if you see the people who are actually using and addicted and cannot live without that, it's become a significant challenge. You'll be surprised that, the drug helpline which we have, it has logged in about 9,500 calls. from April till about, yesterday, day before. 9,500 is a very big number, and you would be surprised that there is not a single call from a female. There was no female caller. And these calls are mostly because of the acute withdrawal symptoms they are having because non-availability of substance, which could be like, hallucinations like shivers or what. It's both physical and mental health problems which are reported, to which these counselors are attending to. If you see, there's another community of the society, the transgender community. We also have a COVID helpline for them. This transgender community is also like, very badly affected with the drug abuse problem, as well as the AIDS related issues, other health related issues. And there also, the several calls have been logged in during this COVID time, because they're completely isolated in the society because their basic economic activity is affected. So definitely mental health related issues are going to be a concern in the post-COVID situation. And
Ms. Chakravarti, just a follow-up on that observation that you made about the calls coming in only from the men. Do you interpret that as the big consumers are, or the users are men, or women are just more hesitant in reaching out for help and basically reaching out for help, that they're more closeted in a sense?
I think, Megha, the answer is like, very obvious, because it has to be seen in a socio-cultural context. I'm not saying that the women do not do that, do not do substance use, but there is a kind of the fear of coming out and seeking help.
Yeah.
Okay. There's a fear of, what others think, what would the society think, what would the family think. There are certain, these factors which affect the ladies or the women to come out and seek help. But having said that, but definitely the percentage of substance use is more among men than women, according to the survey findings, of course.
Okay. Let me take that point across to Mr. Moses. And Mr. Moses, I do want to understand that how does drug use and abuse play out in communities? I mean, we have heard of, this blame game or ostracization, and which is why, also linking back to why women or otherwise vulnerable groups would not come out and, openly seek help. What can a user do? What can the families do? What are the expectations from institutions, to help fight addiction?
Yeah. Drug use has always been seen as a crime, as a sin, or as a thing that only someone with mental problems do. But we've seen that normal people do drugs and they get addicted to drugs. And many people who are doing drugs didn't know they can get addicted. So
that's really important. That's really important, that you never realize when you're doing that first, I don't know, injecting it or popping a pill or smoking up, you're not realizing that could just be, a stepping stone to addiction. Do carry on.
So many people don't realize the depth of addiction, the depth of the disease, and what it does to a person. So many a times they think that the person just they can quit if they want to, but these people really need help, and from institutions and in service providers, they have to understand the person who is in that position. So a very thorough, like the theme of the UN, better knowledge for better care. It really brings out the problem that we have with drug addiction, because people don't really know how deep this goes and how deep rooted this is. So in order to help a person come out from addiction, you really have to know how deep and how connected it is to that person. And yes, in certain communities, they don't understand that kind of behavior.
Yeah.
So this kind of yes, like you've rightly said, awareness is the basic need of every community which has the drug problem. So
Yeah.
I think yeah, this
Yeah.
we need
Yeah.
help. We need.
Yes,
And
yes. So it does seem very pertinent. Like we are emphasizing, and I come back to Mr. Kapanos, that awareness, knowledge, that is basically empowering. That is going to be something that is going to empower institutions. That's going to empower families who have users, their siblings or their children who are using narcotics. And again, I'd like to understand how you view communities helping out in fighting addiction.
Well, we have a number of projects, and immediately I can recall our project in Nepal, which introduced innovative work approaches with women who use drugs, women who inject drugs, female prisoners, many of whom are also using drugs, and women living with HIV and AIDS. Well, we develop a mechanism, a social mechanism, linking communities and encouraging, social activism in communities. So the women reached by the program are now empowered leaders in their field. Many of them form their own organizations and also have formed support groups and networks to pass on the knowledge and the skills that they gained through UNODC support and mentoring. So this is really important because without activities on the ground, nothing can be reached. And for this, we need to be closer to people, to communities, and encourage, I would say, internal power, internal potential of communities to fight, to struggle, and to succeed in combating drug abuse and trafficking. So this is a kind of feedback. So any successful management, any successful governance depends heavily on the principle of feedback and involvement. So social involvement, social cohesiveness is really very important in addressing this. So communities should be at the center of our efforts, at least if we are talking about demand and harm reduction. So without huge involvement of communities, nothing can be reached at all.
Right. I do want to also briefly touch upon, the issue of reuse, that after rehabilitation, after being clean for a while, is there a chance for, how do you ensure that a user doesn't come back into the trap? Sergey, would you like to take that?
Well, this is a real trap, and for this, the role of the mass media and social networks is of utmost importance.
Yeah.
So, knowledge, awareness, and sensitizing people about threats, about realities they can face.
Yeah.
So this is of utmost importance. I'd like to emphasize it.
Yeah.
So that's why we need to establish a very close contacts with the leaders in the mass media area and make use of all the available levers to promote this knowledge.
Right. Mr. Srivastava, would you like to add to that?
Yeah, absolutely. I think almost equally important as the treatment aspect is the aspect of rehabilitation of a victim of drug use so that he does not get back into this trap. And I think the Ministry of Social Justice and Empowerment in its various action plans has particularly, this particular aspect in mind. And it's also important from in our perspective, that you do not want the same set of people to be entering into the trap of drug use, and so therefore adding to the illicit drug economy. Critical, if I may add, the aspect of rehabilitation of a victim of drug use, but I think the doctor would be better equipped to answer that one.
Okay, let me then just open this to everybody, and I'm going to go one by one. And I do want to understand, and I know that we spoke about this in the questions that I did raise previously, but I want to, in a capsule, in a nutshell, if you can, share good practices and interventions that you that have been carried out in response to the drug problem by your particular institutions. And then, because we are basically seeing how synergized efforts can bring about a massive change. If you were to refer to your particular institutions or your particular area of experience, please tell us about the best practices, the interventions, and how effective have they been in terms of the vulnerable groups. And I'd like to start with Dr. Bilai, if you could take that question first, and then I'll go across to the other panelists.
Thank you very much. My point is complicated. As you may know, I am Sergey, and Sergey is me, and UNH is a consortium of 11 UN agencies, actually. And we have put our heads together to really see how better we can answer to the AIDS epidemic from different angles. And UNODC is leading, of course, the area on drug use and, if you want, the mitigation, and mainly to see how better we can really reduce, if you want, the transmission of communicable diseases among people who use drugs. And we have had very good experiences, and Sergey will come back on that. And one of the important pieces, if you want, we have had last year in Gujarat was really to bring the Minister of Home Affairs, the Minister of Social Justice, ourselves, and to discuss with the state legislators, the state police bodies, and to really see how better we can get good practices, good examples of what a good, if you want, a prison could be, and using the President Nelson Mandela's rules. And that was really a good, an important step in the right direction. And that's where we have presented actually the data on the HIV survey among prisoners. And what is important and shocking is, as I said, this big amount of prisoners who are really drug users, they are there because of this practice. And that is something which we have really to really look at it and see how better we can solve the issues. Somebody who is using drugs, as our colleagues of AIMS and have said, the Minister of Social Justice have said, we have to recuperate them. We have to make them good citizens. We have to help them to be productive. We have to help them to, again, take care of their families, be part of the society, be really productive and not be really a lost person or a marginalized person. Those are principles which we really are looking at as much as possible, working with UNODC and making sure that UNODC is, how to say, getting our support as much as possible in really moving forward. But I'm really optimistic with the Minister of Social Justice, AIMS, and all the Drug Use Forum in India, which is, as Sergey has said, the community is critical into this. That's the way, as you insisted, how to really get people not to come back is really important, to really get the community involved as much as possible. And we have really a solid forum which exists in India. And we are continuing to collaborate with that forum, which is part of our CCM, it is part of our CSOs, and it is part of NACO. And we will continue to really push for those perspectives as much as possible, and to really see how better we can continue to replicate those best practices, bringing together law reform, prison reform, and drug use reform, if we can use that. But in conclusion, I will really say that harsh laws are not the solution. Prison is not the solution. And dealing with people in an, I will say, harm reduction approach, right-based approach, and helping really to understand the root causes of the problems and solving them is really the answer, and that's the way to go. Thank you.
Lost your audio.
Megan, your audio.
Yeah, I can't hear too.
Yeah.
Yeah,
You have lost your audio, Megha.
Can you hear me now? I'm so sorry.
Yes.
I'm so sorry. I'm so sorry. I got carried away. So I'd like to come. I'd like to go across to Ms. Chakravarti. Good practices intervention in a nutshell.
Yeah, Megha, I was waiting for this. I think, one very good intervention I feel is that, involving everybody, like teachers, peers, parents, and community into our interventions. I think that's a very good thing because, a child listens. Child, I mean, like below 18 years, listens to teachers more than anybody else, followed by influence from the peers. So when we are involving them in all the activities, then the impact is going to be more. That's one thing. The second thing is once a person reports for treatment or counseling, after the treatment or counseling, the organization which is providing this has to do a follow-up, and has to do a telecounseling at certain frequencies that has been made mandatory with the organizations. I think that is another intervention. The third thing is that, for the special settings like prisons or for special groups like women and juvenile, we have set up this special de-addiction facilities. And for the northeastern part of the country, we have a model rehabilitation center sanctioned in Mizoram, which will cater to the needs of the northeastern people, where actually the prevalence is also more. I think that's another good, fair intervention. And we have recruited. The one best thing is that, whatever interventions the ministry is taking, what is the impact in the field? Impact on the intended beneficiaries is something which we need to do it in a very systematic and a mathematical way. And we have these 20 young professionals selected from the top universities in the country, who are from the IITs, who are from TIS, who are from, Stephens, the top notch. We have them, and we have placed them in the field. We have trained them and placed them in the field. So they are going to evaluate the impact of our schemes, our interventions, in the field, and give us a feedback, I think, which will be very fruitful in our future endeavors.
Right. Thank you so much, ma'am. I'd like to hear what Mr. Srivastava has to say on the interventions.
Yeah, the most important intervention that we have put through in the last 1 year or so stems actually, I don't know if am I audible?
Yes, you are.
Oh, great. Stems from our appreciation of the problem statement itself. Now, we have recognized clearly, and I'm coming from enforcement agency background, and yet we have clearly recognized that this problem is not a law enforcement problem alone. It's absolutely crystal clear to us.
Yes.
And so therefore, it's very, very important that we get all perspectives on the board, the perspective of treatment, of rehabilitation, of awareness generations, of availability of drugs for the use that the nature has meant them for, access to pain medication. If you pick up the World Drug Report today, it will say that 80% of the world's population still does not have access to pain medication. All of that has to be a part of a concerted effort for us to address this problem. All right, so what have we done about it? The Ministry of Home Affairs, realizing this problem, actually created a new NCORD structure. It's called Narco Coordination Structure. It came into effect in July 2019. What it does, it's a 4-tier structure right from the apex to the Home Secretary to the field at the district level SP. At each of these structures, every single agency in the country involved with drug control in different aspects is a part of that. And there are periodicities of meetings, of exchange of information. What do we intend to achieve with that? Exact, precise theme that the UNODC stands for today, better knowledge.
Yes.
We believe that with this interaction, we will all have better knowledge, appreciation of each other's work. And so therefore, ultimately result in better care. I think it's a very significant intervention that the ministry has done in the last year.
Brilliant. Thank you, Mr. Srivastava. And now I'd like to take this question.
Sorry. You have forgotten your UNODC probably.
I'm sorry?
We have the whole arsenal of innovative approaches.
Sure.
Very successful projects implemented. So
I was leaving it for you to intervene.
Yes, yes, Mr. Kavanos.
Yeah. So first of all, we are promoting as a UN agency a systematic approach addressing equally demand, supply, and harm reduction. So this should be kept in mind. And we have successes in all these 3 areas. If we are talking about demand, a very successful story can relate to the establishment of the Central Asia Regional criminal intelligence sharing and coordination center. This is a tremendous success in combating trafficking in narcotics stemming from especially Afghanistan, but not only. So this is a real success. And we're promoting the same mechanism in South Asia. It is called SARI. And the success of the project will depend heavily on the support of the South Asian countries' governments. So some of them revealed their wholehearted support, and we are waiting for the approvals from some other countries. Another area of success, and this is very encouraging if we are talking about drug menace. So I'd like to highlight a very new and innovative program, which is called Family Skills Program. And as you know, family is undoubtedly one of the most influential social institutions. And the main objective of the Family Skills Program is to decrease the risk of drug use and other health and social outcomes among young people through evidence-based prevention, especially if we are talking about relying on improving family functioning, bonding, and communication. And I can just quote, although not just word by word, something which is mentioned by all those who were involved in the program in Bangladesh. For instance, one child mentioned that parents sometimes do not understand us, that is children, and we also misunderstand them often. So program will understand each other much better. And the guardian of the child told the UN ODC representative, it was an amazing training because this is the first time we have understood the importance to act as a family, rather as only a member. We have learned the importance of understanding our children and their expectations. Our child also realized how important it is to understand parents productively. So our request is to provide such trainings for all students and their families in Bangladesh. I believe that there is a humongous, I would say, room for such programs in India. Some other areas, very, I would say, topical now. So we are talking about COVID-19 crisis. I'd like to emphasize that, the immediate impact is the rise in demand as a result of social, economic, and psychological pressure. Anxiety. So the motivation for many people increases in terms of looking for something which can be used as a tranquilizer, if you will. And narcotics are they available through the darknet. It was mentioned by Mr. Srivastava. So a lot of new channels are developed by traffickers, and this is really dangerous. So. And we have developed a very good program. It is called Lockdown Learners. It is a series of online engagements with students and educators in India on COVID-19 and its impact on people and its relevance to rule of law and drug use, etc., etc. These dialogues aim to sensitize students on concerns of vulnerable groups and emerging issues such as drug use, cybercrime, misinformation, gender-based violence, discrimination, mental health, corruption, among others. And also, I'd like to emphasize that we need to unite our efforts. And first of all, we have developed an excellent report and established an excellent partnership with UNAIDS and some other UN agencies in Gujarat. There is an outstanding UBRAF project, the government of Gujarat is also a partner and involved in a big way, and this is focused on drug addiction, HIV, etc., etc. So This is something to be replicated in other states of India.
Yes, yes, yes. Thank you, Sergey, for those very important points. And I'd like to take that question across to Dr. Ambikar now. And, you know, we've talked about this in this conversation, how you dislike the word addicts. Can you talk to me about the psychological and the emotional intervention that is also required?
Yeah. So basically, what we need to understand first is that drug addiction or drug use disorders are illnesses. They are medical disorders just like diabetes or blood pressure. This is also related to your earlier question of restarting drugs.
Yes.
We somehow believe that just one instance of treatment should be enough for someone to never touch drugs in their lives once again. I'm sorry, that doesn't take place. Multiple relapses and then multiple episodes of treatment, attempting to quit, they are part and parcel of the long-term recovery process. Just like diabetes or blood pressure cannot be managed by a few days or few weeks treatment, in many cases they would require lifelong effort, lifestyle changes, medicines and consultations and counseling for a very long time. So is true for drug addiction as well. So there is equal importance of medical interventions like medicines as well as counseling, other kinds of lifestyle changes to ensure a long-term recovery process. And to add to what are the good practices or interventions that we have done, despite being a super specialty hospital of AIIMS, our maximum effort has been towards demystifying the fact that drug addiction treatment requires some very high-class kind of intervention. What we have been doing is working to demonstrate that even in community, even basic health facilities like a general duty doctor and counselor can also very well provide with very limited resources effective treatment of drug addiction. Treatment center does not mean a hospital where you need to get deposited for 6 months at a stretch. Even at the outpatient clinic level also, people can come, take their medicine and consultation and can go on leading very productive lives. And that's what we have been working very hard towards. We have been helping about 30 government hospitals across the country run such clinics. And now with the support of Ministry of Social Justice and Empowerment, we are on this path to support 125 more such hospitals to open addiction treatment facilities, which are really low cost, low resource kind of, but effective interventions for people suffering from drug addiction. Thank you.
Yes, yes. Thank you so much, Dr. Ambikar. Mr. Moses, you know, like what Dr. Ambikar was also pointing to was that there is this sense of you know, putting the shame on the user, that which is why a lot of times that even when users and addicts want to seek help, there is a certain you know, that pressure of society, that what are people going to say, that badge of shame. Do you think that addicts carry that badge of shame, and what is the kind of intervention that you know, what could be the best practices to help break that cycle and for them to be able to seek out for help?
Yeah, we don't like being called addicts, first of all.
Yeah.
We prefer the term people using drugs, or if it is injectors, then we call them people who inject drugs. So I think the national act or all those official documents could also change this, and that would be very preferable. And yes, I think it had to start from the government. I think they have done a commendable job in the drug part, but certain things like we have mentioned, the mental health of a drug user is very important. So regarding the mental health, the way you address a person also is very important.
Yeah.
So I think in that way that I think the government can help us in getting to our feet. And in our community during this COVID-19 pandemic, our community has risen up to certain heights in where we gave help to our community members in certain areas like where you have mentioned about acute withdrawal symptoms. We have helped people in that. So we have negotiated or advocated with the national program like NACO to open up their OST centers so that our community can get withdrawal help from their OST centers, and also the interesting thing is there is also a huge case of overdose during this time. So many of our people are suffering from overdose. So overdose management was many of our community members receive overdose help from the India HIV Alliance people, but that is not enough. It is only for a little bit. So since the community cannot get drugs during the lockdown period, when they are able to go and get it, then the chance of overdose becomes very high. So the overdose cases have risen up in the recent days. And there are lots of things like basic needs like nutrition and shelter. Those kind of things are also very important to our community. So I think our community has helped itself during this time of need, but we also need help to help our friends. So I would like this kind of help we need within our own networks. And I think if Mr. Srivastava, you can have a dialogue with our community, I think it will help us both in this battling drugs and everything.
That'll be fantastic.
We are conscious of that, Moses. We will do that. Yes.
Okay, great. Thank you, Mr. Moses. And I'm wanting to wrap this discussion up in the next 10 minutes. And I do want to hear one last message from all of you, because I'm sure a lot of people battling drug use, contemplating drug use, are going to be watching this. Families of users and injectors might be watching this and learning from this. So I would like each of you to send out a message. But just before that, can you all hear me?
Yes.
Yeah. So just before that, there are a couple of questions that have come in, and I would like to thank all the people who are attending this session, watching it as this goes along. So I'd like to take just a couple of questions. One, Ms. Chakravarti, I think you could take this up. There's somebody who wants to know that are there dedicated centers, rehabilitation centers for minors, for children, and what is the kind of provision for children? Because it's become so rampant. You see these kids on the road either inhaling or injecting. What is the sort of provision that is made for children particularly?
Yeah, Megha, here children, I would presume that they are below 18 years. So the below 18 years children, we do have de-addiction centers for them. Like for example, in Delhi too, we have one for we have for girl children separately, and for the boys and the juvenile boys separately. Okay. So there is a provision, and I had earlier mentioned that the special settings for women, for children, and the girl children would go with the women. And in prisons, these are the three places we are having these de-addiction centers, and we have a long-term plan to set up these because we see the vulnerability there.
Great. Thank you so much. Another question that's coming in, and I think I'll be able to take just this one question. I think, Dr. Ambekar, would you like to take this up? People want to talk about, and we've spoken about how young kids, college goers are more impressionable. They're also more vulnerable, perhaps. And there is a question about peer pressure. How does one, as a family, as an adult, as an older sibling, navigate or mitigate the chances of a drug use for a college goer?
Yeah, so basically what needs to understand is the late adolescence and early adulthood are the most vulnerable periods for initiation of drug use. It's actually addiction which develops later, but initiation usually takes place in these impressionable ages. So, and one of the main reasons behind starting to use drugs in this period is, number one, some of the mental health needs which you already may have, some of which may actually be biologically determined, which means you do not have a control over them. and some of maybe the environmental cues which you get from your surroundings. And a combination of these actually leads to addiction. So what was the clear message needs to go from to anyone, any young person is that using drugs is not a norm. Irrespective, because whenever some surveys are conducted, you will find a very interesting finding. Majority of people would say that majority of their colleagues are using drugs or using one or the other substance, but they themselves would not report that they are using it. So there is a perception that drug use is commoner than they believe. But the statistics, all kinds of statistics everywhere in the world, they prove otherwise. So drug use is not a norm. It's not something which everyone is doing it and hence I must do it in order to fit into the crowd. That's very important to know. And secondly, it's also very important to know that there are actually no gains which actually can be made by taking drugs. Also, it's very important to know is that if we adopt a zero tolerance kind of policy, right? If we say that every substance or everything is a no for anyone, it means all things, every stuff, every drug will be kept at the same pedestal. And hence, if you break one kind of transgression, then you have done already sort of broken that barrier, and then you must use what's the harm in trying other things also. So that kind of graded response is always important in terms of our messaging to young people as well. It's very important to say that be informed, at least these and these and these are a strict no.
No-go.
So that kind of awareness in peer education is very important. I'm sure Moses would also like to add to something to this.
Very interesting. And you know how nuanced it is. That is what is so interesting for me, that this cannot be one blanket rule and you have to understand. Brilliantly put, Dr. Ambekar. Moses, would you like to quickly add something to this?
Yeah, see, like India is a very diverse country. For every community or for every state, let me say, for every pocket of community, the message is going to differ because our cultures differ. So in giving awareness, you have to give the right kind of message to the right kind of people. That is very important. And so I would say that for parents, I would say teach your kids not to take drugs. And for kids, listen to your parents. And don't start, because starting is the point where you don't know when you get addicted, so you just don't start. For institutions, give awareness, the right message to the right people at the right age. And for service providers, be empathetic. And for my fellow drug users, don't lose hope.
Don't lose hope. What an important message. And let me just thank the people who had asked, a lot of people. Anil Sharma, that question was from Anil Sharma. Thank you so much. Reshma, K, Ravindran, thank you for your questions. I will not have the time to take all the questions, but I do thank all of you for joining in. And just before we wrap up this panel, I would like to definitely hear from all of our panelists that one lasting message that you want to leave our viewers with. This video is going to be up on YouTube, it's going to be watched again and again. It's going to be consumed by users, like I said, families, people who are seeking out for help. One message, and I'd like you to keep it as short and brief because that's what leaves an impact, they say, in the media. So one message, Mr. Kapanos, would you like to start with that one lasting message on this very important day from UNODC?
Thank you. My message will be very short and based on this year's theme. That is, know more, care more. Addressing the world drug problem requires responses that are based on facts, solidarity, and compassion. And a special message for youngsters: love, live, and laugh.
Love, live, and laugh. Beautiful mantra. Thank you so much, Dr. Sergey Kapanos, for that message. Dr. Bilai, over to you now for that one message that you're going to leave us with.
I think my message is a simple one now. We have to be part of humanity. We have to work together. We cannot leave our people out. We cannot marginalize our people. People who are using drugs, people who are injecting drugs are our sisters, our brothers, and our children. And we have really to make sure that we are giving them the care which is necessary, the support which is useful, and the hope that there is a tomorrow. Thank you.
Thank you so much. Thank you so much. Brilliantly put. Dr. Ambekar, over to you.
Just very brief two-line message. Number one is drug use is not a crime. Number two is give help, get help.
Give help, get help. Very important. Today, Mr. Srivastav, message from you, sir.
Yeah, taking off from where Dr. Atul left, drug use is not a crime, but in using drugs, you are helping a lot of criminals that are destroying the health and moral fabric of the country. Do not do that. Life is too precious to be wasted on drugs. If you really want to be addicted to good health, sports, and fitness. And as I'll borrow a line from the actress Taapsee Pannu's message in our social campaign, next time somebody asks you, what are you high on? Just say, I'm high on life.
On life, high on life. Brilliant. Ms. Chakravarti, message from you. These are all, quotable quotes. I'm going to have my team get posters made with these in, air quotes, inverted commas. Brilliant. Ms. Chakravarti.
Yeah, I think Megha, my message is almost clear in the earlier messages, but still I would like to make certain phrases, which to the audience and to the youth especially. I would like to say that every single smile, touch, and feeling has an impact on positivity. So be positive, adopt a healthy lifestyle that no COVID can beat, smile more, and more importantly, do not hesitate to seek help when required. And stay with us in making of Nasha Mukt Bharat.
Nasha Mukt Bharat, that is the dream. Moses, last word comes to you. You've been in the situation, you're out of it, you're helping others. Your word is going to be important.
Okay, so my message would be that I would like to remind everyone that drug users are human beings. And to my fellow users, know your responsibility and just remember, treatment works.
Treatment does work. There is always a way to come back, and that is going to be possible with the right information, seeking out for help. Do not hesitate. And this is the lasting message I think that we want to leave you all with on World Drug Day today, the 26th of June. I would like to thank, from the bottom of my heart to all the panelists that we had today. What a brilliant conversation. And one that must be had in the clamor of breaking news. Sometimes the most important questions and most important issues are left unsaid. And I'm so happy and glad that we could do this today. Mr. Sergey Kapanos, Regional Representative for South Asia, UNODC, Mr. Bilai Kamara, Country Director for India, UNAIDS, Ms. Radhika Chakravarti, Joint Secretary, Ministry of Social Justice and Empowerment with the Government of India, Mr. Rajesh Nandan Srivastav, Deputy Director General, Narcotics Bureau, Control Bureau, Government of India, Mr. Atul Ambekar, Professor at the National Drug Dependence Treatment Center at AIIMS, Mr. Moses Pachwau, he's the President, Indian Drug Users Forum. Thank you so much once again for this time and for this brilliant conversation.
Thank you very much.
Thank you, Megha, for excellent moderation. Superbly done.
Well
Thank
done.
you so much.
Thank you.
Thank you so much. For
Thank you.
more, you can
Nice
log on
talking to
to
you.
onlymyhealth.com. That is the health website under the Jagran New Media umbrella. A big thank you also to UNODC for helping us do this and helping us bring this important conversation to the forefront. Thank you once again. Have a great day and a good weekend.
Thank you, indeed.
Bye-bye. Bye-bye.
Bye-bye.
Bye-bye.